This conference will now be recorded.
Greetings, everyone, and welcome back to our Healthy Living on the Go series. My name is Ruth Miller, and I'm a physical therapist with Health Pro Heritage. We're a family of therapists, wellness, and fitness experts that have worked with you and other seniors for more than 20 years. Today's video, Staying Vertical, Fault Reduction and Balance Promotion, is just one in our Healthy Living on the Go series, and one of our videos designed to bring fitness and fun right to your doorstep. So let's get started. What is balance? Balance is the ability to control and maintain your body's position as it moves through space. Balance requires a coordination of all sensory systems, including vision, how we see, proprioception, or the awareness of the position of movement of our body through space, and the vestibular system, which includes parts of the inner ear and brain that help control balance, our neurological and muscular responses as well. Balance is a skill. It's a learned motor pattern that you either keep it or lose it. Practice and challenging these systems can help improve our balance. So our model for postural control includes balance at the very center and all the other systems that help coordinate and maintain balance. So we have our vestibular system that I just spoke about, that are parts of the inner ear and brain that help control our balance. Our somatosensory system that relates to any part of sensation like pressure, pain, warmth, that can happen anywhere in the body. Our neuromuscular system is how our nerves and muscles work together to control movement. And our musculoskeletal system of our joints, bones, tendons, muscles, that give support and allow movement to occur, as well as our vision and our cognitive components all help in maintaining good balance. Some changes that we may typically see as we age includes the loss of flexibility, especially in our legs and our joints in our legs, like our hips, knees, and ankles. We also have some decreased strength in our ankles, knees, and hips. We may find less control of momentum or coordination. And we also may see some reflexes that have changed over time and have an increased and prolonged reaction time, like when we take our foot off the gas pedal to put the brake on. Are we as quick as we used to be? We also may see vision and any sensory changes. Maybe you find that you're walking slower, maybe with a shorter step length, and maybe even a wider base of support. All these are typical changes that we find as we get older. So now I want to talk about some fall facts. Unfortunately, falls are the leading cause of death from injury in our senior population. There's a greater increased risk for falls as we get older. 1 out of 3 of our 65 years and older fall each year, but less than half of those people speak to their healthcare providers about it. They don't mention it to their physician, to their nurse, to their physical therapist. And so many falls go unaccounted. And among older adults, falls are the leading cause of both fatal and non-fatal injuries. In 2014, 2.4 million non-fatal falls among older adults were treated in the emergency room. 750,000 individuals were hospitalized of those seen in the emergency room, with a cost of at least $30 billion in 2014. And we do know that the cost continues to rise as more and more people continue to fall. In a study of people over 72, the average healthcare cost for a fall-related injury was over $19,000 per person. So how can we help ourselves? Well, before we do that, we need to know what causes falls. Falls can be a cause of intrinsic factors, meaning from inside a person, or extrinsic factors from the environment, something from outside. So let's take a deeper look into those two factors that can cause falls. So for intrinsic factors, so those that are a part of an individual person that can affect the risk of falls is if a person has a decrease or less vision or hearing, can cause an increased risk of falls. If a person has become weaker or lost some of their balance abilities, those can cause an increased risk of falls. If a person is on 4 or more medications, that is a risk of falls. If a person has lack of sleep, or if their mental status changes, that can also cause a risk of falls. And if a person has multiple chronic diseases, some of those diseases have increased risk for falls for that person. So you want to make sure you review all of that with your physician. Some extrinsic or external or environmental fall factors include stairs. We know people trip up stairs. If there's too much clutter in your home, sometimes we trip over the clutter. If there's a wet surface, we can slip. If there's loose rugs or carpets, we can trip over them. Or if there's a cord, we can also trip over that. If there's poor lighting, and especially if your vision has changed and you don't see as well in the poor lighting, just aggravates that. So we want to make sure that we have sufficient lighting. So poor lighting is an external factor that can cause falls. And sometimes if we hurry or rush, we're not paying attention to all of our surroundings, and that is an increased risk for falls. There's also the factor of fear of falling. Many people who have had a fall, even if you're not hurt, you develop a fear of falling in the future. So this can cause a person to limit their activity, which causes them to reduce their activity level and their mobility, and thus in turn, there's an increased loss of physical fitness, which of course can increase risk for falls. 60% of all seniors over the age of 75 have expressed a fear of falling, and 33% indicate that they restrict their own activities because they're afraid to fall. Fear of falling is pretty significant. We do have a fear of falling questionnaire that I'm going to review with you in a minute. That our questionnaire can help identify any potential behavior patterns or perceptions that can contribute to our increased risk of falling. So we kind of have to break that fall cycle. The fall cycle is, again, if you've had a fall, you may be more fearful of falling again. Falling can be very upsetting. So because you have the fear of falling, you tend to do less activity because you're afraid, which causes a weakness in your muscles and also a weakness in your balance. So your balance is not as good as it used to be, which in turn may cause an increased risk for falls, which can potentially cause a fall. So somehow we have to break this cycle. So how do we do that? First thing is to identify if we do have fear of falling. So with that, we have developed a questionnaire that you can answer. You can download this. It's one of the resources available, and answer this on your own. Some of these questions include, have you restricted yourself from these activities because you have a fear of falling? Is there any of these activities that you avoid? Some of the activities included are walking in crowded places, walking in unfamiliar places, not doing exercise, not doing as much housework, and have you limited yourself in lifting or carrying objects? So feel free to complete this questionnaire on your own after this presentation. So what is your risk? Over the next few slides, I'm going to highlight some of the common factors that can indicate an increased risk of falls. And I want you to keep track of any of the questions that you answered yes to. So some common indications for fall risk. Number one, have you fallen in the last year or had a near fall, an almost fall? Do you sometimes feel unsteady when you're walking? Are you having more difficulty getting up from a chair to the point that you really have to push off with your arms or pull up on something in front of you to help yourself stand? Do you find that you need support on furniture when you're moving from one place to the next, that you're putting your hand on some tables or a cabinet as you're walking from one place to another? Are you still able to stand on one foot for greater than 5 seconds? Or do you need to stabilize yourself with one hand so that you could stand on one foot? Are you having more and more difficulty reaching down towards your feet to get something off the floor? Or are you feeling just unsteady or a fear of falling? And so you're stopping yourself from reaching down to pick up something off the floor or reaching down to your feet. Have you experienced any episodes of dizziness or having more difficulty turning your head side to side while you're walking? And remember, keep track of how many answers you're saying yes to. Are you having more difficulty negotiating a curb or any steps or other stairs, especially without the assistance of a handrail? Are you having more difficulty reaching up over your head or from side to side? You notice that turning and looking over your shoulder is more difficult now. Or if you do that, does it cause you to be kind of unsteady, or you have to take just an extra step to catch yourself? Do you worry about falling, or are you avoiding some activities due to the fear of falling, as I suggested earlier in that questionnaire? Do you have some loss of sensation, especially in your feet? Do you feel if you're standing on something, on a pebble? Do you have times that you have to run to the bathroom or rush to the bathroom, especially at night, to avoid some incontinence? And are you taking medications to help you sleep or improve your mood? And they may have some side effects that can increase the risk of falls. So what is your risk? If you answered yes to at least 3 or more of the indicators or situations that I talked about, then you are definitely at a greater risk for falls. And you may want to talk about some ways to minimize your risk of falls with your physical therapist or your occupational therapist. So what can you do to prevent falls? The first thing is definitely make an appointment with your doctor and review the following. You might want to review your medications, both your prescription medications as well as your over-the-counter medications, to determine what the side effects are and if there's any interaction that may increase your risk of falls. You also want to look at all of your health conditions that you have, including if you have any visual changes, any hearing changes, any pain, any numbness, especially in your feet, and any shortness of breath that can all contribute to an increased risk of falls. You want to start a regular exercise program if you haven't already. Physical exercise and activity can go a long way towards fall prevention. I spoke a lot about learning to move, and we have great trainings and video demonstrations of exercise classes, of Zumba, of morning stretch, of general exercise. So if you haven't already, please take advantage of watching those and participating as the teacher, Deborah, teaches the class, because that may help you just start an exercise program. Some other common exercise programs are a walking program, Tai Chi, or aquatics. And if you can't access it, or if you've already accessed those programs, you can also speak to your physical therapist who can help develop a personal exercise program for you. You also would want to remove any hazards in your home. So you want to remove any clutter and make sure high traffic areas remain clear. You want to remove or secure any rugs that are loose, and you want to store items that you could reach easily. You want to make sure to have proper lighting and sufficient lighting in your home to reduce the risk of tripping, or to make sure that you could see all the objects when you move from one room to the next. And you may want to speak about this with your occupational therapist, because they can help you identify any hazards and make recommendations on ways to lessen the risk of falls, or help you identify devices that can be used to make your home safer. And you also want to consider what you're wearing as shoes. High heels, floppy slippers, and shoes with no backs can make you slip, stumble, and fall. Also, walking in your stocking feet also can increase the risk of falls because it may be slippery. So you must want to consider changing what kind of shoes you wear as part of helping your fall prevention plan. You want to really work on finding shoes that fit properly, sturdy shoes, and have non-skid soles. You also want to work with your physical therapist and occupational therapist to identify underlying issues which may contribute to an increased fall risk. And some of those tests that our therapists may have you complete are different balance tests. They may be checking your overall strength, coordination, flexibility, and even your activity tolerance. They may evaluate how your posture can contribute to your fall risk. So they may want to assess what your posture is and how you can effectively improve that. They also may determine if pain may be contributing as a fall risk factor. Remember, the key to success is early intervention. So you would want to contact your therapy department, your physical therapist, your occupational therapist, if you're experiencing any of the issues that we described earlier, because they may be able to help you reduce your fall risk. So before I leave you, I just want to show you that we do have another resource for you to download, and that's just a one-page on 6 tips to help reduce falls. So this is all that I spoke about already today, but you might want to keep it handy just for you to review to help you reduce your own fall risk. So I thank you for joining us today. We're so glad you took advantage of our Healthy Living on the Go program. On behalf of Health Pro Heritage, I'm already looking forward to next time you tune in. Have a wonderful day.